Hi, how are you doing, nurse?
Good, how are you?
Good. Can you tell me about Mr. Joe, please?
Yes, we have a male, 45 years of age. He has severe pain, usually at night, painful inflammation, and the pain is in the right great toe. The toe is hot, red, tender to the touch, and swollen.
Okay, that sounds good. Let's go take a look.
Okay.
Hi, how are you all doing today? My name is Dr. Guzman, and this is Nurse Nancy, and we're going to be taking care of you today, okay? So, Mr. Joe, could you tell me what's going on exactly with your condition?
I've been having sharp pain in my big toe, especially during the night. And it's been getting a little bit better, but there's still reoccurring events at night.
And it's not just his toe, it's like the whole foot. He complains about the whole foot at night like a big baby.
How long did your night pains last?
Usually throughout the night. It lasted a few days, but now it's been weeks and it hasn't gone away.
Mr. Joe, I'm going to assess your toe area. Do you mind if I do that right now? Is this tender
Yes.
when I touch it?
Yeah.
Okay. What about right here?
Not as much, but still. Yes.
Okay. And up here?
A lot more, yeah.
Okay. And on a scale of 1 through 10, with 10 being the highest, how would you rate your pain?
Right now, 6 or 7, but at night, 9.
Okay. So 6 or 7 for his pain, but it's worse at night, like a 9, around 9. And it's very swollen in this area, and it's very tender to the touch, and it's also very red. Okay. Thank you. Now I'm going to ask you some questions about your lifestyle and see if that's affecting your condition right now. So how have you been drinking lately? Alcoholic beverages?
Maybe about 3 or so a night.
Okay. What about smoking? What are your smoking habits?
I don't really smoke.
And how often do you exercise per week?
Maybe once a week.
Or not.
Okay. Your girlfriend doesn't seem to agree though.
It's off and on. Not as much as I should be.
Off and on. Okay. What about your diet? How do you drink a lot of dairy products or any other?
A lot of processed meats, yogurt, and dairy products.
Okay. We found that your blood pressure was very high, so Nurse Nancy here is going to take your sample from your big toe, and we're gonna test it in the lab to see if there's some uric acid crystals. Okay.
We'll be right back with you.
Thank you. Mr. Joe, we're back again, and one more question for you. Has your family, anyone in your family, have they ever had gout?
My father had a few episodes, and my grandfather, I believe, had a few.
Well, the test came back positive for uric acid crystals in your big toe, and it looks like you have gout, which is a complex form of arthritis caused by too much uric acid in your blood, which can be normal in some people, but in your case, it's not normal since it's causing inflammation and pain and swelling. And for some people, it can form hard crystals in the joints, in this case, your big toe. So, Miss Nurse Nancy, what can we use to treat gout?
For some relief, we will give you some ibuprofen. We recommend therapeutic lifestyle changes, so stay hydrated, keep a low dairy intake, cut back on alcohol intake, and drink more coffee. Get plenty of vitamin C as well.
So nurse, is it serious? Is he gonna lose his toe? Are we gonna cure this gout?
So it looks like he came in right on time. There are no signs of advanced gout or kidney stones. There's a good chance that the gout may reoccur. However, we have some medications to help with that, so I think he's fine.